Do you want to learn about psychological growth without sorting through the jargon? You're in the right place. This is the Relational Psych podcast. I'm your host, licensed therapist Tyson Connor. On this show, we learn about the processes and theories behind personal growth and experience a little bit of it ourselves. Join me twice a month for candid conversations about therapy and psychological concepts with real mental health professionals, using understandable language and simple experiments that you can try yourself. Keep in mind, this podcast does not constitute therapeutic advice, but we might help you find some. So today, I'm here once again with Dr. Jessica Kim. Hello.
Hello. Hi, Tyson, and hi, everyone.
Dr. Kim is currently a postdoctoral fellow here at Relational Psych, one of my coworkers.
Yes, I get to work with Tyson every day, which is it's okay.
It's an experience.
No, it's a treat. Yeah.
And today we're going to be answering the question, what is psychological testing used for? And specifically at Relational Psych, what do we use psychological testing for?
Yeah. So I am going to go about this two ways. But usually people come with a diagnostic question, or they are wanting to know something for a certain purpose of getting accommodations or getting an official documentation or proof of whatever it is. And so most people come in with the question of, do I have ADHD? Do I have anxiety? I feel like there's something going on. What is going on? And a lot of times our clients are looking for answers.
Generally speaking, people come in with a question of, do I have X, right? Do I have ADHD? Do I have autism? Do I have anxiety? And the reason that they have that question could be because of some need for official documentation.
Correct.
Something for school or work, something like that.
Yeah. So just like Tyson said, yes, most people are coming in wanting something, wanting a report. And it's because the institution, the school, doctor, or whoever is looking for an official document that confirms that they have blank or they don't have blank.
Right. Gotcha.
Yeah. But just beyond that, I do want to talk about how there are so many different types of psychological testing. For today's purpose and what we do here at our RP is more comprehensive psychological testing. We don't do neuropsych. We don't do forensic. That's a different specialty. We won't be able to do it here. But if you have the question of, do I have ADHD? Or I feel like this is more than depression. Or I just want to know more about myself.
For the sake of the listener and also for me, because as the listeners might know, I am not a doctor. I am not trained in psychological testing. That's not part of what I do or what I know about. So what is the difference between this comprehensive testing, which is what we do here, and neuropsychological evaluation or forensic evaluation?
Yeah, so I can't speak to it too well because I'm not in those fields. But from what I know, you have to have special training as a neuropsychologist to administer neuropsych testing, which is more like testing for Alzheimer's or dementia. So it's more looking at the brain cognitive functioning. Yes, we also do that too. We look at like executive functioning or intelligence levels, but I would say neuropsychologists do more in depth, and they look at more functions of the brain, which we're not really trained for to that extent. And forensic psychology is different because it's used for like trial.
So what I'm hearing is that like a neuropsychological evaluation is interested in like what is happening structurally, organically in the brain, right? What's going on in there? Are you experiencing some kind of neurodegenerative disorder like Alzheimer's or other things that could cause dementia? Are there certain parts of your brain that are being impacted in specific ways that are causing this kind of outcome? And a forensic evaluation is an evaluation that's for the legal system. That's
Right.
what it's for.
Yeah.
It's for a judge to look at and for some lawyers to look at and to say, are you fit to stand a trial? Is this someone who has like a personality disorder that maybe isn't safe to go out on parole or whatever?
Yeah. So exactly all of that. So different purposes. And because these fields or these specialists are trained so differently and more specifically, I would not be comfortable administering any of these tests, nor do I know how to, or the language and everything just looks so different.
Right.
And so, so that is something that we will not be talking about, but we'll be talking more about just general comprehensive psychological testing where most people are wanting diagnostic clarity and wanting treatment recommendations.
Gotcha. So diagnostic clarity, meaning they want to know, do I have, do I have? What's going on in my brain?
Yeah.
And as a psychotherapist, I often diagnose people, usually when they need a super bill for insurance reimbursement. Right. And my diagnoses tend to be more broad and more, for lack of a better word, kind of vibes based, right? I'll go down the checklist of like, what symptoms do you have? Yes or no. And then I'll just diagnose based off of that. But it sounds like this kind of evaluation, this comprehensive evaluation is beyond the level of just self-reported symptoms.
Right.
It actually evaluates like certain parts of mental functioning.
Right. Yeah. So the way that we do testing is that kind of like what Tyson was saying, all therapists do diagnosing. This is a different type of diagnosing that's more in depth and more, I would say, robust. So it's not just based on you and sometimes we're humans, so we can be subjective. It's not just that, or just the questionnaires, but it's a lot of norm testing, a lot of other clinical interviews, not just with the person, but like with parents or with spouses. And so we have a lot more data. We have a lot more evidence for whatever we're saying that this person might possibly have.
Right.
Yeah.
And norm testing is the idea that like the tests that you administer, you know what the results mean relative to like the norm of the population, the general population, right? So like, if someone, is given a scale of 1 to 5 and they circle 5 every single entry, then looking at that, like how unusual that is, how far it differentiates from what's normal.
Yeah, for sure. Yeah. So it's really just backed up by a lot of research, a lot of stats. And so I would say that's why it's robust. And so sometimes when I can't trust myself and my subjective, diagnosing, like I feel like the data, the patterns, the consistencies that we do see throughout the whole testing process, when I give my feedback session, I feel pretty confident that this is what the client has. And I'm able to answer the question because it's not just me, but there's just so many other things that we're considering. And so I feel really confident that I know the person, that I've gotten to know the person throughout this whole testing procedure.
Neat.
Yeah.
Neat. So what are some like of the institutional, like systemic reasons that someone would want evaluation beyond like getting to know yourself better or separate from that?
Yeah.
What like is this like people's like doctors' offices that are asking for these or workplaces? What are the situations?
It can be all of the above. I have done, I think the most typical ones that we do here is ADHD diagnosing. And so that would be for if students want accommodations. So they're center at school, they're wanting a report. They want concrete evidence that they have ADHD so that they can get accommodations for their academic challenges. Sometimes psychiatrists also want testing done and a report so that they can prescribe medication. I've also done accommodations for like bar exams. And so basically that would be confirming that they have a mental health condition that will make it more difficult for them to perform compared to the norm, and therefore will need additional accommodations.
Gotcha. Okay. That makes a lot of sense.
Yeah.
So let's talk a little bit about this, like, the comprehensive Like it's the comprehensive evaluation, right?
Right.
What's so dang comprehensive about it?
Yeah. So I think if I could explain it, I would say this exam or this comprehensive testing is kind of like when you go to the doctor. You're kind of like, okay, I think I have a cold. I'm not exactly sure what this is. So doctor says, we'll do a bunch of tests. We'll do a blood test. We'll do this and that. And we'll figure out what's really happening to you, right? So it's not just your symptoms that you're reporting, but we're looking at all the different functionings of your body to see what's really happening, right? And is it a cold? Is it a flu? Is it COVID? So to know what it is means that you'll get the right kind of medication, the right kind of treatment. And that's why having an accurate picture of what this is and where it's coming from really helps you to treat what's going on. And that's kind of, what we're trying to look for when we do testing. And it's comprehensive because we are like complex beings. We're not just symptoms. Different things interact with other things, your cultural background, different, if you have other mental health conditions, all of it interacts.
Yeah.
And so it's not just a standalone, we're looking at your symptoms, but we're trying to capture where some of these symptoms are coming from and how it integrates with everything.
So it sounds like you're looking at a lot of stuff, gathering a lot of information.
Right.
And one of the like really big primary reasons maybe that people get this is because they need documentation of like, this is what's happening for me. So that for some systemic reason, right? A school providing accommodations or to, the bar exam example is fascinating to me. But it sounds like we also use this process to try to assist people in like getting to know themselves better. Can you talk about like how does the psychological testing that we do here, how can that serve someone as they just come to know themselves deeper?
Yeah, no, that's a really good question. And I think that's one of my favorite part of doing assessments. Of course, like the diagnosing and of course having a name, a DSM, name for what is going on is very helpful. But at the same time, I think what most clients don't really expect from our testing, our reports are 25, almost 30 pages long. So it's very comprehensive, is that they are able to know themselves better. And I feel like I've done my job. Of course, like I want everything to be accurate, but I don't know if this is a good assessment of like if I actually wrote a good report or whatnot, is when the feedback that I get from clients is, wow, this sounds just like me. Or, oh, so this is what was going on. Or they would say something about like, wow, like you really know me, right? And so in some kind of way, I feel like sometimes when I do these feedback sessions, my clients feel so known and understood, and they have vocabulary or knowledge of understanding, like this is something that I've experienced. Now I have words for it. Now I have like explanations of why this is so, because we focus so much on the whole person. So a lot of assessments, not saying that all of them are like this or not like this, but a lot of them are more symptom driven of like, I just want to know what this person has. Very diagnosis driven. I would say the way that I hope to approach assessment is the whole person approach of like being able to see the whole person. And so I think whenever it speaks to not just the symptoms, but how it interacts with the being of the person, or maybe just tying in and connecting some of the dots of like why this symptom is there and how it manifests in real life. And then if we have treatment recommendations at the very end that ties it together of like, okay, this is where it came from. This is how it shows up. This is what we can do about it. I just feel like, clients find that very helpful, and they feel like, okay, this is very personalized. This is just not like what I can Google, but this is like catered to me.
Yeah. You said a minute ago that ADHD evaluations are really common. So let's use that as an example. Like someone comes in, they get this comprehensive evaluation, and through the process, you're like, oh yeah, ADHD is heck. Great. Like first of all, how would that show up in testing? And then how would that show up in the evaluation? Like how would it come out in what you're writing about? And what would some of the recommendations be?
what comes to my mind is just the process of what we do for ADHD testing here is that a lot of times we use Google or even nowadays like TikTok or social media to say that, oh, I fit criteria for ADHD.
Sure.
But the thing is, yes, but I think all of us do struggle with attention. And so I think what we do with our testing is that it's not just questionnaires and self-report or personal experience, but we do look at normed, I think I explained this, like testing, and also we do hands-on testing that looks at the executive functioning, which is directly like related to ADHD.
Right.
And so I
executive functioning, for the listeners who might
Yes,
not know,
thank you.
is like it encompasses a lot of things that we use our minds for, but not everything. Executive functioning is like impulse control, like short-term and long-term memory, decision making, those sorts of things. So like someone can be like if and we all experience like decreases in executive functioning when we're stressed out and tired, right? So if you've ever been stressed out and tired and maybe haven't had your daily stimulant of coffee for the day and you like left your phone at home on the kitchen counter on your commute to work, right? That's a failure of executive functioning. Your executive functions are the parts of your mind that say, hey, don't forget to grab your phone. Hey, don't forget to call your dad. Hey, don't forget to turn in that report or that piece of homework, right? So and executive functionings are a lot of the like mental functionings that do get pretty directly impacted by ADHD.
Correct.
And, you know, there's that old saying, according to Dr. Google, we all have cancer, right? And like, I think the more modern version is, according to Dr. TikTok, we're all neurodivergent, right?
Yes.
And like maybe a lot of us are. That's a valid thing.
Yeah.
And everyone experiences like decreases in executive functioning just from like being a human in the modern world.
Exactly. Yeah. So we're not diagnosing based on TikTok or just the DSM,
Right.
but we're looking at so many different things. We have questionnaires for ADHD specifically. We do want to ask about childhood. So we're going to ask about childhood symptoms. We're not just going to ask you. We're going to ask someone to report on your current symptoms, someone to report on your childhood symptoms. And so I think we get so many data points. And what we're looking at here is we're not just focusing on one test, but throughout the whole testing process, are there patterns? So when you come in for testing, I also am observing your behaviors.
Sure.
Is that consistent with an ADHD profile? And so we're looking at peaks and patterns, elevated scores, and then that's when we kind of put it together. That is just kind of like the diagnosing part. But I think when we integrate and weave in the person, I think we consider the person's culture, the person's upbringing, what was said about ADHD when they're growing up, and if they do have other underlying mental health concerns such as anxiety or trauma. Something that we try to do is we try to tease it apart because a lot of these symptoms overlap. Not just that, but we want to also talk about how trauma and ADHD integrate with each other, how it gets manifested in real life, and how it all integrates. And so I think that's kind of a unique thing that we can offer. We put it into context.
Have you ever had an experience where someone came in for an ADHD evaluation and they like from like the DSM checklist, they would have totally met criteria, but then through the course of evaluation discovered that like because of cultural factors or trauma or whatever else that actually you didn't feel like ADHD was appropriate? Does that happen?
Oh yeah, that happens a lot.
Really?
Yeah, I mean, not a lot, but yeah, because a lot of these symptoms, do overlap. So for example, like restlessness, like hyperactivity. If you have experienced trauma, it could look like hypervigilance or anxiety.
Right.
Also, the symptom is restlessness. And so some people might think, okay, this might be ADHD, but really, if you dig deeper, it's not.
So this is a great one. And I want to dial down on it a little bit more because I think it's a great example. Hypervigilance is specifically when someone who has experienced trauma, their body and their mind is constantly on the lookout for where the next like hurt is going to come from, where the next danger is going to come from. And that can look a lot like both hyperactivity that you see in ADHD and inattention that you see in ADHD, right? Because hyperactivity means if you know your Greek and Latin roots, it means that someone is too active. Hyper means too much, right? They're just they're bouncing off the walls, right? When you think about ADHD, you might imagine like an 8-year-old kid who just can't sit still, right? That's hyperactive. But there's also the other side of ADHD, which is inattention, right? I've worked with people who were deeply inattentive ADHD. That was their diagnosis. And like that didn't look like a kid bouncing off the wall. That looked like a kid who was like, were they depressed? Were they traumatized? We didn't know. And it took a little while to figure out, oh, this is a kid with ADHD, but they don't have the hyperactivity. They just have like, for whatever reason, they can't, their attention couldn't stick, right? So they were sort of daydreaming or off in another world or like thinking, for this person who I'm thinking about, they were thinking about Star Wars. That's what they were thinking about. They were thinking about Star Wars all the time. And if someone's traumatized and has hypervigilance, their mind is looking out for the danger so much that it can look like they're just not paying attention because their mind, because of the trauma, is saying like, it doesn't matter what the teacher's saying. It doesn't matter what your boss is saying right now. It doesn't matter what your wife is saying right now. What matters is keep an eye out for where the danger might come from.
Exactly. Yeah.
Sorry, that got me excited.
No. That was all very important things to say. And something that I want to say and ask is the Star Wars.
Yeah.
Was that you?
Could have been.
Okay.
Could have been.
Sounds like you've been.
Oh man. Yeah, no, the person I'm thinking of was even more into Star Wars than me. So
okay.
yeah, they
I
were.
see.
And that's another feature of neurodivergence in general, but including ADHD, right? Is having a special interest.
Oh yeah, for
right?
sure.
And this is where the whole tic-tac diagnosis thing gets complicated because like it is a common human experience to be passionate about things and to be really interested in things.
Yeah.
And that doesn't necessarily mean that you have ADHD. And whether you have ADHD or not, being really interested in things isn't necessarily bad.
Yeah, no, definitely. All of those things. And I think that is why the context really does like matter so much. Because you can ask about, like if I was just going through a checklist, I could just be like, when you were younger, did you have issues with attention? If they just say yes, I can check it off for ADHD symptoms. But if I actually really ask deeper questions, what was happening at that time? It could be they were going through a lot of trauma. So obviously, like Tyson explained, if you're going through trauma at that time, it's hard to focus on your schoolwork when there's so much outside noise. And so I think that's why understanding the person's story and seeing the context back then and even now is so important.
Yeah. So when you're actually writing this like 30-page report, like first of all, that's impressive.
Yeah, it's very long.
To have a 30-page report as part of your job. Woo! I just have to write case notes, and they are never even a page long. How do you weave this stuff together? Like, do you even write like, do you bring in people's stories that they tell you and say like, when like the client told us this story about growing up and that points to like this and this and that, or?
Yeah. So kind of like what you would do in therapy where you connect the dots. I think we try to connect the bigger dots, right? And so, yeah, we do bring in, they said this during the clinical interview, and then it matches up with their test data. So we connect the dots.
Gotcha.
And yeah, so I think that's kind of how we do it. We summarize it, we bring things together.
Yeah.
And so at the very end, the summary section, it usually ties everything together.
Yeah.
And so, yes.
So outside of ADHD, what are the like big picture categories that you're paying attention to?
Yes. We are paying attention to. So usually what we do try to look at, it depends on the person's diagnostic question, but if it's like personality, so we would look at personality functioning, and that could be through some of the norm testing. We do projectives, we do clinical interview. For all of it, we do like to talk.
So just to slow you down real quick, norm testing is like one of these tests that someone takes and then you get a score and it can compare to like the norm scores.
Yes, correct.
What is a projective test?
A projective test is a bit more different. I would say it's a bit more subjective in the sense that, so this can be, there's something called the TAT. So I will show you pictures and you have to kind of describe what's happening. or sentence completion, or even the word shock. And for this, we're looking for themes. And usually it feels like maybe it's never actually a one-off. It does tie in together. And so some of the themes that they talked about in the TAT or sentence completion, it does match up with and is consistent to some of their scores or things that they said in the past. And so we kind of bring all of that together. But TAT gets more like qualitative stuff.
Gotcha.
Yeah.
Gotcha. So it sounds like the projective measures are not giving you a number at the end. It's more subjective as opposed to being objective.
Exactly. Yeah.
And they're about looking for themes that come up. So if you have, I've never taken any of these tests, although who knows, maybe I will over the course of my time here. I'll invest in it.
Yeah.
There's like, if someone is constantly talking about through these images that you show them, they keep talking about themes of war and conflict and violence, then that's relevant, as opposed to themes of like loneliness or isolation or disconnection. Like these are things you'd be paying attention to, and then connecting that back to other measures that you might have had.
Correct. Yeah. So all to say that nothing is ever standalone. So I'm not going to diagnose or say that you have something based on what you put down on your sentence. It needs to make sense in the bigger picture, and also it needs to be consistent with your other elevation of scores or what you've said or what another collateral person said.
Right.
Yeah.
You won't just give someone a Rorschach ink blot test and then say, well, that proves that you've got borderline personality disorder. That's not how it works.
Yeah.
Okay.
Yeah.
Cool. Very neat. Yes. So what after this like initial feedback interview, or what's it called? It's called
a feedback session.
Feedback session.
Yeah.
After this feedback session, you give, say one of our listeners comes to see you for psychological assessment. They have this feedback session. You talk through what you've come up with, what you found, and then they have this 30-page report now. What do you do with it now?
Yeah. Usually what clients do is after we go through it together, they like to read over it. They like to read over it and just like digest what we just talked about, because it's a lot. And then at the very end, we always do try to give very tailored and personalized recommendations. And so I think that could be a really good place to start. There's always, if you're seeing a therapist, there's recommendations for therapy. So I have clients that give the report to their therapist of like, okay, this is me. I know we talked about these things, but this is another way to get to know me. And I want to talk about these things. And so, so that's one way. Like we talked about in the very beginning, we can take the test and the report. So the ones that we write for you, the 30-page ones, it's actually for you to understand yourself. If you want a redacted report that's shorter, that just kind of stays focused, we can also shorten or edit the report so that you could give that to your employer or to your school.
Interesting.
Yeah.
So when someone comes for assessment, they get the 30 pages and that's sort of like the whole thing just laid out end to end. But if someone says like, wow, a lot of this stuff that you've written about like my personality structure and my like avoidance of conflict and stuff, this is really useful. I'm going to talk to my partner about this. Could you give me a version that I could take to my boss to explain why I need more frequent breaks at work or whatever? And then that'd take out all the conflict avoidance stuff and all the personality stuff and would just be about whatever, like sensory processing or whatever this person is speaking to.
Yeah, definitely. Yeah. So we're not going to be like biased and cut things out or whatnot. We want to be accurate and honor what we found. But yes, like I think we're going to take out a lot of the personal history stuff. Right. And so we'll edit it so that it's accurate and it's still like it still protects you, at least the privacy part.
What's an example of a like treatment recommendation that you would put at the end of one of these assessments?
Like I said, there's always a therapy recommendation. So whatever themes came up, or it could be anxiety or trauma or whatever it is, we try to actually give recommendations of findings that might be more underlying. So the underlying stuff, how about we look at this in therapy, right? So there's that. We also give very like practical like recommendations of like try reading this book recommendations, podcast recommendations. We always like to include like a self wellness type of recommendation that's more like catered towards what could be fulfilling and satisfying for the person, not just like go running or exercise, but more personalized than that. And if the person is coming with ADHD or whatnot, we like to give more specific ADHD recommendations based on what we found from their cognitive testing.
Right.
Yeah.
And again, this comes back to, I'm thinking about like the issues of like of Dr. Google and Dr. TikTok, where like the recommendations on social media can be generally good in the same way that like everyone should exercise. Everyone should spend 30 minutes a day in like proximity to nature, right? All these things are true.
Yeah.
And when you have more specific information, you can say, and for you specifically, it might be really helpful to do some yoga where you focus on your shoulders because your shoulders are tight, right?
Yeah.
That's like a physical kind of based thing.
Yeah.
But like from a cognitive level, what's an example of like a sort of specific, like because of how your ADHD shows up, consider this self-care thing?
We had a client that was just very, very verbally like skilled, as in like very discussion heavy. When it came to like writing essays and things like that, could not do, but was an excellent public speaker. She verbally processed everything, but she actually had to write a whole thesis. And she's like, I can't do this. But in every presentation or any group discussion comes up, she does very, very well.
Yeah.
And so I think knowing her strengths, and so something that we do try to do during testing is highlighting your strengths. Also really, bringing to light some of the challenges or even struggles or even areas of growth, but we like to be very strength-based. These are your findings. What can we do to maximize your strength? How can we use your strength in this way to maybe help with the areas of your weakness? And so for this person, I think because it was so clear that she had very strong verbal skills, we even recommended things like, like when you're about to write your essay or whatnot, verbally process everything in a voice recorder, process all of that. And then, or if you're having a conversation about the essay with your friend, record all of that and then use that to guide your thoughts. Because that's what works for you. Like things like that, I would say are more personalized.
Cool. Yeah. That's very neat.
Yeah. Therapy is awesome because we get to know ourselves and we also grow in insight. And I think assessment is a different way of doing that.
Yeah.
Yeah. It's not like you're meeting with a therapist for 45 minutes, but it's not as long, but it is still very comprehensive. And it's a different way of also getting to know yourself. And I think we all know how useful having insight is.
Yeah.
It's such a good, it informs where to start, where to begin, and what direction to go towards. And so I think that's why assessments are actually really cool. And it can work hand in hand, as in like after you find out these things about you through assessments, you can work on some of these things in therapy. And so I would say it goes hand in hand.
Yeah.
Yeah.
Yeah. That's a really, I like that. That's a nice cherry on top. That wraps it up really well, I think. Thank you for coming. This was fun.
This was fun. This was a blast.
Special thanks to Dr. Jessica Kim. Dr. Kim can be found at Relational Psych. For our experiment today, we are going to give you the option to take your own psychological assessment. Kind of. This test that you can take online is one of the many tests designed to evaluate attachment styles. This is the one that I actually took in grad school. It's linked in the show notes. This test is a series of yes or no questions that are designed to identify your likely attachment style. This is a normed test, so the results are reliable and valid for those of you who care about what those two words mean. However, it doesn't get to the same level of depth that a genuine psychological assessment interpreted and explained by a psychologist would. This is simply a questionnaire that outputs an answer and that you can interpret for yourself from there. For those of you who look at the URL, it does look a little sketch and weird. Yes, it does. That's just because it's old. It's an old link from back before people were interested in branding information about attachment styles. If you just Google attachment style quiz, it's actually kind of hard to find this link, but I'm glad I found it again because it's a reliable test and I know it works. For further reading, this is a little bit tricky. If you're interested in psychological assessment for yourself, you really ought to get some. Go out and get it yourself. That's the best thing to do. It's a bit of an investment, but that really is the best option, to go to a professional and get yourself an assessment done. The reason being that if you research and learn a lot about these assessments and how they work, it can actually interfere with your results. If you studied it and learned all the ins and outs of it, then it's less likely to work on you because you know exactly moment to moment what each answer means and what it studies, and that impacts how you react. So if this is something that you're interested in for yourself, we highly recommend that you get it done before learning about it. If after that warning you're still interested in learning about it, I recommend starting with YouTube, actually. There multiple different professors have put videos of their courses on YouTube available for anyone to watch. During the pandemic, a lot of classes went online, and some of those classes became open source. So I think that's a great place to start. There are also a lot of textbooks that are about things like the foundations of psychological assessment and testing, psychological assessment and testing, second edition. These will be pretty academic and pretty in-depth, but if that's something you're interested in learning about, I think YouTube is a great place to start. The Relational Psych podcast is a production of Relational Psych, a mental health clinic providing depth-oriented psychotherapy and psychological testing in person in Seattle and virtually throughout Washington State. If you are interested in psychotherapy or psychological testing for yourself or a family member, links to our contact information are in the show notes. If you are a psychotherapist and would like to be a guest on the show, or are a listener with a suggestion for someone you'd like us to interview, you can contact me at podcast@relationalpsych.group. The Relational Psych podcast is hosted and produced by me, Tyson Connor. Carly Claney is our executive producer, with technical support by Sam Claney and Allie Ray. Our music is by Ben Lewis. We love you, buddy.